Queenslanders have done exceptionally well, as we all know, in our fight against COVID. We were one of the first jurisdictions in the world to offer our people the chance to be vaccinated before our first wave arrived. And I have no doubt that this saved hundreds, if not thousands, of lives. And I really want to thank everyone who has gone out and got vaccinated. In order to keep people safe and allow lives to return to normal, we required people going to places like pubs and cafes and sporting stadiums to be vaccinated. Today, I can announce we are easing some of those restrictions, and the Chief Health Officer will go into some more detail. So from 1 a.m. Thursday, April 14, most venues that have been open only to vaccinated staff and patrons will be open to all. It's time to reunite Queensland. Pubs, clubs, cafes and restaurants, theme parks, casinos and cinemas, weddings, showgrounds, galleries, libraries, museums and stadiums. The requirement for vaccinations will still apply, of course, in vulnerable settings. We don't want people in hospitals to get sick, in aged and disability care, in prisons, in schools and early childhood centres. The trigger point is our level of vaccinations. As of yesterday, 90.5% of Queenslanders 12 years and old and over have received at least 2 doses of the vaccine. This is incredible. The restrictions we had in place did their job, keeping our community safe and encouraging vaccinations. The Chief Health Officer is comfortable, given where we are in the current wave, that these restrictions can ease from next Thursday. But we still need parents of younger children to consider getting children vaccinated. 50 pop-up sites are open for vaccinations at schools across the state, in addition to existing sites. And masks, of course, are still encouraged where people still feel they are in vulnerable settings. But let me say this too. If you are unvaccinated, please consider going and getting vaccinated. We know the evidence is clear. You are more likely to end up in hospital and risk severe illness. It is absolutely important too that people still go and get their boosters. The Queenslanders have done a great job, and I thank you for everything that you have done, but the time has come to ease some of these restrictions as we return to a new normal and as we go about reuniting Queenslanders. I know it has taken a heavy toll on families, on businesses. I thank them for the work that they have done, and I still urge people who are unvaccinated, if you have any concerns, please go and talk to a health professional, as you are more likely to end up in hospital if you are unvaccinated. I'll hand over to the Chief Health Officer. Thanks, Dr. Gerard.
Thank you very much, Premier. We now have clear evidence from multiple sources that we have passed the peak of transmission of the secondary Omicron wave in Queensland. We're basing that on data, on PCR data, on the RAT data that we receive, the rates of positivity that we receive, the rates of furloughing in staff that we are aware of, the data on furloughing in hospital staff, for example, on calls to ambulances and on calls to our helpline. So we have solid evidence now that we have passed the peak of transmission of the secondary COVID wave, which we know is due to the BA2 variant, with 75% of our most recently sequenced viruses being of the BA2 variant. Now, this is the community transmission, so it's a peak of community transmission. Hospital admissions we know will lag a bit, but I would expect to see hospital admissions, people in hospital, to start to fall sometime in the next 7 days. That's what we're projecting. Sometime between now and Easter, we will see falls in the number of people in hospital. In effect, this because of vaccination, it is clearly because of vaccination, the impact of this virus on the Queensland community has been relatively mild. We have had a significant increase in the number of hospital admissions associated with this wave, probably about a third or a half of what we saw during the initial Omicron wave in January, but very few admissions to the intensive care unit. So at present we only have 4 patients right across Queensland ventilated in the intensive care units due to COVID-19. 4 patients out of a population over 5 million, and that is clearly due to widespread vaccination, because we know that vaccination protects us against severe disease. As now that we've reached greater than 90% of those over the age of 12 vaccinated, it is time for us to move on, and we'll move on as from the end or from the 14th of April, because that's when our hospital numbers are projected to fall, just before the Easter break. And we're lifting, as you've heard, lifting the vaccination mandates on most public venues: pubs, clubs, cafes, restaurants, theme parks, casinos, cinemas, showgrounds, galleries, libraries, museums and stadiums. Our focus now in terms of vaccination requirements will be on the high risk and vulnerable settings. And that is likely to be this is likely to be the philosophy going forward around the world, focusing on hospitals, aged and disability care centres, prisons and schools. And as I've said before, and I cannot overstress this, vaccination will remain the key going forward. As our restrictions are gradually lifted, it will be the vaccination that will be protecting us all from this disease. The virus is not going to go away. The virus is not going to go away. You will be exposed to this virus sometime during the course of this year, and it is the vaccine that will protect you. And for adults, that means 3 doses of vaccine, not 2 doses. And if you're in certain groups over the age of 65, or First Nations person over the age of 50, or immunosuppressed, a 4th dose to protect you in the coming months. So thank you very much. I'll hand over to the Minister. Thank you.
Thank you. Well, it's a great day for all Queenslanders. We're able to take another step forward in easing restrictions and reuniting Queenslanders, and we've only been able to do this because of the amazing efforts of everyone across Queensland. We know when we put these measures in late last year that it was tough to do so, but it did its job. It meant that our peak of our first wave was under 1,000 people in hospital, when it was predicted to be in the thousands. Of course, now we're coming out of our second peak, and that is less than half. So that's great that we are getting these results, and it's because of our high vaccination rates. But it is important that we continue to protect the most vulnerable, and that's why many of our settings around restrictions, mask wearing and vaccinations will continue to apply in those settings. So our hospitals, aged care, disability, in our schools, prisons, watch houses, youth detention centres, and of course also still for workers in airport settings as well. But lifting it in these venues, we know, is going to make a big difference to business out there. We hope it will strengthen business and help our economy grow even stronger. And again, we want to thank all Queenslanders for their patience and their commitment to doing the right thing, because it's because of all of that work and the advice of our Chief Health Officers and the work of our health officers all across the state we've been able to get to this point. But it's not until 1 a.m. next Thursday, the 14th, that's when we expect that we will start coming off this peak. And as we have always done, we're doing this in a considered and careful way. We are lifting this at a time that we have confidence that these restrictions will stay off. We didn't want these restrictions coming and going. We wanted to give business certainty, and we want to give business notice, and that's why we're announcing this today. And again, we are grateful to all Queenslanders. Our focus now is on vaccinations. First and foremost, getting your boosters, whether it's your 3rd or your 4th vaccine. If you are due, please get that vaccine. And to parents, please get your children vaccinated, particularly those 5 to 11-year-olds that are still under 50%. take the opportunity during these school holidays before children go back to school, because we know the spread of the virus in the school community. Take this opportunity over the school holidays when we have around 50 pop-up clinics occurring and our other existing vaccination centres open to get your children vaccinated, and also to get your booster and make sure you're up to date with your vaccinations. Sorry? Yes, sorry, I did mean to clarify. So for all those venues where you no longer need to show vaccination status for both patrons and workers, that means there'll no longer be check-in required as well. Yeah. So we still, at a local level, hospitals will make those decisions as to whether there needs to be any suspended elective surgery based on demands. But I'm very pleased to see that our number of staff that are in isolation and quarantine has started to come down over the weekend, and the numbers that I've got today are around 200 less than what we saw last Friday. So we are seeing that coming down, and we're very comfortable that we can manage this, remembering that we had more than double this number of staff out of the workforce at our peak during the first Omicron wave back in January. So we're comfortable that we can manage this, and these restrictions have done their job for what we needed them to do over December and January and February, but now we can move forward and ease some of those restrictions even further. Well, the incentive to get vaccinated is to not end up seriously ill and in our hospitals and in ICU. I think that's a pretty big incentive to get vaccinated. It's also not just about whether you think you're fit and healthy and don't need a vaccination. What we've seen, particularly with Omicron, is that it spreads through our children and through the community. So by us choosing to not get vaccinated, we are putting the most vulnerable in our community at risk. Disability advocates are talking to me all the time about their concern about the most vulnerable in our community, not just those in aged care, but in the disability sector as well. And we owe it to them. We owe it to every person who can't get vaccinated for medical reasons, for the elderly, for our loved ones in aged care, and for those with a disability to get vaccinated so we can reduce the risk of spread and reduce the seriousness of the virus so that less people are ending up in hospital and in ICU. Yeah, mate.
I think it's very unlikely they'll be reimposed. There would have to be a novel strain of COVID-19, more virulent strain, more contagious strain. That seems unlikely. It's one of the scenarios that was mentioned as a remote possibility by the World Health Organization in their press release earlier this week, but that seems an unlikely scenario. So it is not our intention to go backwards on these mandates. In the current situation, no. It really would depend on if there was an unexpected virulent strain that appeared, but that's very, very hypothetical. And I really must emphasise, this virus is going to come and go. It's not going to go away. We're going to have waves coming and going. The level of vaccination in Queensland is very high. The anti-vax group is taking up a disproportionate amount of oxygen. And I think a lot of these mandates have put a lot of stress and demand on a lot of the proprietors of some of these facilities. I know it's put a lot of stress on showgrounds, for example, and I think to do that for the sake of a very small percentage of anti-vaxxers, the public health benefit is marginal.
You're saying that 12 plus vaccinated over 90%.
That's right.
95.
For over 12. It will continue to spread in Queensland. It's not going to go away. It's going to continue to spread. You will be exposed to it. What we are saying is this particular measure has no public health benefit now because of the proportion of people that are vaccinated. We're talking about a very tiny proportion of people who, for whatever reason, have refused to get vaccinated, and to put this burden on a lot of these facilities, pubs, clubs, cafes, showgrounds, for the sake of this small group of people. The public health benefit is just not there.
We know people feel safer when there is a mandate going out on the venues. What do you say to families going into winter where they spread to their schools and to see that this is going on?
Well, again, the main thing is to get yourself vaccinated. If you've had 3 doses of vaccine, or 4 doses if you are more vulnerable, you are well protected from severe disease. And the number of people out there who are unvaccinated, although they seem like a large number because they make a lot of noise, they're actually a very tiny number.
Can I just say one quick thing? Sorry. So, I'll say a couple of things. So, last year we were really concerned about the vaccination rates before that Omicron wave came. And Queenslanders did a great job. And areas in this state that I was so concerned about were sitting around 50 and 60%. They are now over 95%. In fact, the vast majority of Queensland is over 95%. Also the other day, the Gold Coast hit 90% second dose vaccinated as well. So there is still pockets of our state where we would like to see further vaccinations, but the time has come. I have heard so many stories about families being divided over this issue. With these high rates of vaccination, now is the time. Now is the time for families to reunite. It has been an incredibly stressful time for everybody. People need to get on with their lives, but the key is vaccination. The vaccination protects you. And now the onus is on individuals and families. We've got a big job to do. We've got a recovery underway, our economic recovery. We've also got an Olympics to plan for. There is a lot to do in this state. You've seen a brand new opening of a hospital here today. I want people to be safe. We're going to continue to protect those most vulnerable members of our community. And that is why those mandates will stay for some of those sectors. So I want to thank Queensland for the great job. We'll release a map later on today in terms of how those high vaccination rates have been across Queensland. And like I said, now's the time for families to be reunited. Thank you. Thank you.
Thank you.